Welcome back, everyone. Dr. Arabpour is with us today. Glad to have him back. He's a cardiologist from Lima Memorial's Heart Institute. We always love when you're on because you explain things so well for us. First of all, we're talking Afib. We focus on the heart this month. Tell us what that is.
Good morning, Jeff. Thanks for having me. Atrial fibrillation, for the most part, is an irregular heart rhythm that involves predominantly the upper chamber of the heart. While it is rarely a fatal condition, but it could be associated with a significant mortality and morbidity if left untreated. What happens with the Afib is that the chaotic fast rhythm takes over the upper chamber of the heart, and as a result of that, the patient starts to have a fast rate and lack of proper function of the upper chamber. That predisposes the patient to forming a blood clot in the upper chamber of the heart, then subsequently risk of a stroke goes up, not to mention the feeling of a palpitation, signs and symptoms of congestive heart failure that goes along with it. So it's very important to identify the patient, treat them, and offer modalities that would help perhaps regain the normal pumping function of the heart and the normal rhythm of it.
We've talked about this before. I think most of us are guilty of being so bad about going in when we do feel some sort of thing that's out of the ordinary. When we talk about Afib, what should we look for? When do we go in and get help from you guys?
Great question. Atrial fibrillation, as I mentioned, associated with a very fast rate. So if someone feels that while they're not active, they're starting to have palpitation, their heart rate is fast, even somebody who checks their blood pressure and they find out that the heart rate is reading 110, 120, 130, or even if the rhythm is irregular, those are the telltale signs that perhaps they're dealing with atrial fibrillation. At the same time, most common symptoms of atrial fibrillation is just simply being fatigued. Some patients don't have any symptoms except feeling fatigued, sleepy, and totally different than a usual baseline. Shortness of breath could be another sign and symptoms of it. So any of those need to trigger probably an evaluation by their family physician or perhaps in a cardiologist's office.
Yeah, and you guys, we're glad to know that you guys have same-day cardiology appointments. That, obviously, time is of the essence there, right?
Well, it is. And again, the last thing you want is that you diagnose atrial fibrillation after someone in their 50s have had a massive stroke. That's catastrophic. The impact of it on the patient's life and their loved ones is immense. I mean, it's just unbelievable. So with what we go through these days with the COVID and emergency rooms being the front line for dealing with the COVID, if possible, you want to avoid an ER visit. So we, for past few years, have been offering a same-day cardiology evaluation, both for those who are established as well as the new patients. All it takes is a simple phone call to the office. We'll be able to schedule you for the same-day visit, and testing the treatment would initiate the very first day.
Excellent. That number is 419-224-5915. Same-day appointments are available. Dr. Arabpour, thank you so much. Appreciate it.
My pleasure. Thank you for having me, Jeff.
You bet. Nice talking with you. We'll be back right after this.